Hello everyone, my name is Laura and I'll be talking about neurological assessment alongside my group members Melissa, Kush and Shannon. A neurological examination is an evaluation of an individual's nervous system that may be performed with instruments consisting of cotton wool, tuning fork, reflex hammers, and pins, however does not cause any pain towards the patient. The nervous system consists of the brain and spinal cord, which is assessed on motor skills, sensory skills, reflex, balance, and coordination. The extent of assessment may depend on many factors and problems that the patient is experiencing, such as age, health status, smoking, BMI, and especially those with diabetes. In accordance with Baker, a diabetic is at a higher risk of neurological problems due to the calcification within the arteries that are prone to and they are more prone to seeing a podiatrist for neurological testing due to peripheral neuropathy. Furthermore, according to Reinsberg 2011, the aim of a podiatrist is to ensure optimum foot health and comfort. However, in regards to neurology, the aim is to prevent, diagnose, and monitor and treat any potential disease or nerve damage within the motor and sensory neurons in regards to the patient. So within a podiatry practice, it is important to complete a thorough evaluation of the nervous system to see if there's any reason to consider there may be an underlying problem.
I will now talk about infection control and legal issues. As with any physical assessment, hand hygiene is crucial when performing a neurovascular assessment to avoid any patient-to-clinician or clinician-to-patient contamination. It is paramount that the clinician adequately performs the 5 stages of hand hygiene before the assessment. An understanding of the various modes of transmission of infectious organisms is also essential in infection prevention and control. Knowing when to apply the basic infection control requirements during a neurological assessment is also important. For example, when the clinician is touching a patient during proprioceptive position sensation tests, it is important for the clinician to wear gloves to reduce the risk of contamination from the patient's foot to the clinician. It is also imperative that the equipment used during a neurological assessment, such as a tuning fork, is correctly cleaned before and after use. This will eliminate the risk of contamination, because when any instrument is used on a patient, bacteria comes into contact with the equipment. This therefore means that if it's not adequately sterilized, there may be a buildup of bacteria which may infect the patient. Patient consent is another important factor to consider when conducting a neurological assessment. Informed consent is essentially the permission given by the patient to the clinician for something to happen or agreeing to do something. Due to the nature of a neurological assessment being partially physical, it is important for the patient to be comfortable to be touched. However, some individuals may not consent to being touched or may not consent to exposing their feet. This may be due to religion or gender of the patient. In many religions, such as Islam, modesty is virtue. During a neurological assessment, the patient is required to show their feet, and some Islamic women are only allowed to expose their feet to other women. This would therefore mean it would be culturally inappropriate for a male to conduct a neurological assessment on an Islamic female, as this would breach their religious beliefs. Communication is also vital during an assessment. During proprioceptive and exteroceptive testing, results are patient-specific. This means that what the patient feels will determine the result. Ethnicity of the patient may affect the results due to language and communication barriers. For example, when using the tuning fork, it is crucial for the clinician to explain to the patient what they are feeling is not the pressure of the fork against their skin, but more so the vibration coming from it. If the patient is not from an English-speaking background, this may be hard to convey, which would therefore distort results.
Thank you, Mel. As Mel basically spoke about the neurological assessment, I will be talking more about the effective workplace practices and how we can take precautions to stop the spread of infection. There are a few criteria to it: to avoid spread of infections, to decrease the risk of healthy population falling sick, to reduce healthcare cost, to reduce injury to self, as a podiatrist or patient. Particularly for the patient's perspective, when we use 10-gram monofilament, we make sure they are pre-swabbed and also post-swabbed the filament bases and the equipment itself, so that there is no contamination happening. Particularly if a patient comes to your clinic with the onychomycosis on the plantar aspect of the foot, we do not want to spread the infection or cross-contamination from one patient to another, so it's necessary that we should swab the filament with alcohol swab. Also, there's not much on the neurological assessment available in terms of literature, but also in generally, there was other criteria we podiatrists should follow. For example, hepatitis B outbreak in Los Angeles, which happened when they found out when the basically contamination area and the non-contamination area after performing each procedure was not properly separated. So there was like a clippers used on one patient and then mixed up with another patient's clippers, like where the device was not properly cleaned with this alcohol swab, and they use the same clippers on the other patients. So there was a lot of cross contamination, particularly when you get accidentally give a HEMA on somebody's foot. Also, the clean debris such as nails or skin before the patient gets off from the treatment chair. Biothesiometer should be serviced regularly, yearly, as it is very mandatory to make sure that they are working in a proper condition. From a podiatrist perspective, 5 moments of hand hygiene is very important, as mentioned by Mel previously. Use of personal protective equipment is very important to stop spreading the cross-contamination and also to protect yourself from any blood spills. Vaccination should be up to date in terms of podiatrists. For example, hepatitis B vaccination should be up to date in case you get a needle stick injury or a cut through a clipper on your hand, which shouldn't actually happen, but in case it does. Use of N95 dust mask during burring of the nails, use of nail dust extraction system when burring or using Morris disc, and carefully disposing of sharps in the sharps bin. From the legal perspective, as Mel went through previously, it is very important that we should document and communicate very effectively with the patient, or in terms if the patient could not speak English, any person who understands, and get a proper consent. So whatever we spoke about during our consult, whether it's giving advice, whether it's precautionary thing, or whatever we perform, it is very mandatory that we should write every single bit of information in patient's file, so that in case any problems arise later on, we can go back and refer to, and then we can avoid the legal issues. And I'll pass now to Shannon, who will explain how to perform the neurological assessment effectively.
Correct procedure for clinical practice. Prior to undertaking a neurological assessment, a thorough explanation of the tests that are going to be performed need to be provided to the patient. Consent must be granted from the patient, and the 5 stages of hand hygiene must be performed. Some neurological tests that may be undertaken include pain, light touch, pressure, vibrations, and knee-jerk reflex. For the pain test, using a neurotip, ask the patient to close their eyes and alternate randomly between applying the stimulus to the skin. For the light touch test, apply cotton wool or a feather to the skin. The pressure test involves holding a monofilament to the skin for 2 seconds. Applying the monofilament to the hallux, bases and apexes of the 3rd and 5th metatarsal, medial plantar foot, dorsum of the foot, and plantar heel. The vibration test. Using a tuning fork, apply to the apexes of the hallux, medial 1st metatarsal phalangeal joint, styloid process, and medial and lateral malleolus. Knee-jerk reaction. Palpate the patellofemoral tendon with a slight force and observe the response. It is mandatory that before and after performing these tests to wipe down and sanitize all the equipment to reduce risk of cross-contamination.
Thank you for watching, and we hope you enjoyed our presentation on neurological assessments.